So you've just had your new hip and the surgery has been a complete success, and now you're within the first couple of days or first few weeks of your recovery. And for me, this is one of the most critical stages of hip replacement rehabilitation. And today I'm going to talk you through my enhanced recovery protocol that I ask all my patients to do in the first few weeks post-surgery. So welcome back to the channel. If you don't know me, my name is Mike and I'm a specialist physiotherapist based here in the UK. And today we're talking about total hip replacement recovery. And in particular, we're going to talk about the enhanced program that I take all my patients through. And I'm going to talk you through the first few weeks of that program today. I'm going to include some exercises, so stick around for those because they'd be vitally important as part of your recovery. So let's talk about the exercises you need to do in the first 3 weeks of your recovery. Initially, we need to be doing some exercises to promote the circulation in our legs to prevent the risk of blood clotting or deep vein thrombosis. And we do that quite simply. So I don't want you to just do these exercises 3 times a day, but perhaps whenever you're sat down for prolonged periods, I want you to consider doing some of them. Really simple. We're talking about ankle rotations, pumping your feet, squidging your toes, those kind of things which actually help promote some circulation in our lower limbs. And you would just do 10 or so every time that you think about it, but in particular, every time that your eyes are open, just 10 or so when you're sat down. And if you pair that with getting up regularly, you'll really reduce your risk of thrombosis completely. So we need to talk about the precautions that you need to be aware of once you've had your hip replacement. And these are really simple. So the first thing is we want to avoid bending the hip to 90 degrees or more. So that would be sitting in a really deep seat or lifting your knee up towards your tummy or your chest too high. The second thing is that we want to avoid crossing our legs. So if you're a cross-legged sitter, please avoid this. The third thing we want to avoid is placing a foot on the floor and then pivoting round on that in the first few weeks. We want to pick our feet up to move around. And the fourth and final thing is, and this may vary from doctor to doctor, but is to avoid lying on the operated hip or even the non-operated hip for the first 6 weeks. So you want to lie on your back when you're sleeping. It's important to note that these are precautions, and they're basically there to help with tissue recovery and make your recovery as quick as we can, but they're also to reduce the risk of dislocation. And it's really important to note here not to be scared of these because dislocation risk is really small, but these precautions just make sure that doesn't happen for you. During the first 3 weeks of recovery, we are really focusing on recovering from the effects of the anesthesia, recovering from the trauma of the actual surgery itself. And what I always tell all my patients is that a total hip replacement, although routinely carried out now across the world many times over, is still a major operation and it takes its toll on the human body, okay? So we do need to respect that and bed that into part of our rehab program so that we're taking adequate rest as well as exercising appropriately as well. So the advice that I would give you is to look at the basics first. And those basics are, we want to try and avoid the risk of developing any thrombosis. So deep vein thrombosis comes about after surgery or can occur after surgery when we're just not moving about enough to get that blood flow going through the body. And so that's our number one goal. So movement is pretty critical. And then beyond that, we want to make sure that we do 3 things. And those 3 things are very simple, but often missed. So we need to make sure that we're adequately hydrated. We need to make sure that we're taking in enough calories. And thirdly, we need to be making sure that we're getting enough rest. So those 3 things, if you do them correctly, will help power the body to recover. So we need the sleep, the hydration, the food in order to provide the energy that we need, our bodies need in order to recover. So it should be noted that all of these exercises are safe to perform. They're approved exercises and the exercises that I give to my patients, but they're not appropriate for everyone. So you should check with your doctor or your physio team if you're unsure of any of these. And secondly, if any of these exercises give you sharp stabbing pain that's just not settling, then you should stop and just check with your doctor or your physio team again to see if these are still appropriate. The first exercise is a quad squeeze. You'll need a very light, small towel underneath the knee. And the aim of this is to tense up the quadricep muscles and just push gently down into the rolled up towel underneath your knee. You hold for a count of 3 to 5 seconds and then relax. Repeat this 10 times, 3 times a day. The next exercise is a glute squeeze. And so make sure that your knees are bent and your feet are comfortably on the bed. And in this position here, I want you to squeeze your bottom, hold for a count of 3 to 5 seconds and relax. If you do it correctly, your bottom should rise very slightly off the bed, and complete this 10 times, 3 times a day. Next exercise is a hip flexion or heel slide. And you just start with a straight knee, straight leg, and bend the knee towards you, sliding the heel along the bed, pause, and then slide back out again, making sure you don't take the knee beyond the precaution of 90 degrees of flexion. Complete this exercise 10 times, 3 times a day. The next exercise is an inner range quad. So for this, you'll need a bigger rolled up towel or foam roller or something like that. You could roll up some cushions or some pillows. The exercise is performed by pushing your knee down into the pillow / towels and lifting your heel up off the bed, holding for a count of 3 to 5 seconds. You repeat this exercise 10 times, 3 times a day. The next exercise is a lying hip abduction. And in this position, you just slide the leg out to the side, making sure that your foot and your knee face upwards, so you're not rotating it out or in, as far as comfort will allow, and then bring it back into the middle. You'll complete this exercise 10 times, 3 times a day. First exercise is a standing calf raise. And in this position, we hold onto a wall or to a table and bring both heels up. So you come up onto your toes, pause at the top for a second or two, and then slowly lower back down. You'd repeat this exercise 10 times, 3 times a day. The second exercise is a mini squat. So again, holding onto a table or a wall, bend the knees as far as comfort or pain allows, pause at the bottom, and then drive up with both feet 3 times a day. The next exercise is a standing weight transfer. Holding onto something for support, you would put your weight onto your operated side, hold for a second, and then over onto your non-operated side. So you feel like you're swaying or dancing. Just hold 1 second at a time. We'd repeat this for 10 repetitions, 3 times a day. If the standing weight transfer isn't comfortable, you might like to try a standing march instead. And again, hold on to something for support. And then we're just rocking our knees forwards and back. So it's almost like a mini march. You don't have to take your feet all the way off the ground. You can just lift your heel up and back down and alternate the feet. And you would consider doing this 10 times, 3 times a day. The final exercise is a standing hip extension. And standing, holding onto a wall, you take your leg away from you. Try not to bend too far forwards or too far back. Pause at that position for a second. Bring it back to the start position. And you would complete this exercise 10 times, 3 times a day. So that's my first 3 weeks total hip replacement recovery plan for you. It works really well. It's really important to be diligent with these exercises. So there's no point in doing them twice a week. It just won't make any difference. You have to do them every day, 3 times a day to get the best outcome. And I know that you'll be successful with this. So give it a try. Let me know how you get on in the comments below. And thanks for watching. I look forward to seeing you in the next video where we'll talk about weeks 4 to 8 for your total hip replacement recovery.